talk more about the doctor strike. Junior doctors, as they used to be called, now resident doctors, been accused of trying to wreck Christmas with a 5-day strike on the 17th to the 22nd of December, traditionally one of the busiest times of the year for the NHS. That is what the Health Secretary Wes Streeting has had to say. Well, let's talk to Dr Bhasha Mukherjee, who's an NHS GP, not one of those who's striking, but what she has to say about that. Good morning to you, Bhasha.
Good morning,
Thank
Julia.
you so much. Very well indeed. Thank you for joining us. So Wes Streeting says this is a cynical attempt to wreck Christmas by those resident doctors. Do you agree?
I completely disagree. I think this is yet again Wes Streeting trying to scapegoat the resident doctors for the state of the NHS, for his own failings and the failings of the successive governments. And this is really harmful. It's harmful to the extent where we're seeing violence going up at the front lines for NHS staff across the board. I completely understand that the patients feel disillusioned, they feel unhappy, they feel angry. Of course they would. They're paying taxes, and where is that money going? It's not going to frontline staff. That's the sad bit.
Where is it going? This is the question, because the NHS has had loads of money poured into it. It appears to be a bottomless pit. We're actually seeing fewer operations, fewer treatments being done per pound than there used to be. There does seem to be a productivity problem in the NHS. Money goes in, we don't seem to have enough of the staff to do the treating, and not enough patients are being treated. Where is that money going?
So let's be absolutely honest about the population that we have at hand in the UK. We have an aging population, which means complex health problems. We have more people in this country who are reliant on the healthcare service than are able to provide healthcare services. And this is where the problem is, and that there needs to be honesty about this towards the audience and towards the public, that
we've got a load of old, fat and sick people, and we haven't got enough doctors to deal with them. Is that what you're saying?
Well, in a sense, yes. Unfortunately, this is the world that we live in at the moment, and we have to be honest with the public that the NHS is going to continue to need more and more money as more and more people in this country are going to be crossing that age of 65 and going to be requiring more and more healthcare services. And we've also seen the state of the social care as well, which means that people get stuck in hospital. There are cases where absolutely abhorrent cases of people, and equipment breaking at home, and with no other way to get things fixed
unless they're in hospital. Yeah,
they're in hospital.
I've seen some stats suggesting that something like 10% of admissions could be stopped, but if we had decent, social care for elderly people and disabled people at home, but also about 10 or 15% of beds could then be, people could be sent home if they had that decent care. So you're looking at, best part of a quarter of the beds that could be made available. And people not having to be treated because of those failures in the community. I've lost track of the number of health secretaries I've interviewed telling me they're going to do the joined up thinking on that. It never happens. I do not understand why. It's so the simplest, most obvious and probably the cheapest way of dealing with the crisis in healthcare. However, is it right, with all those pressures, for resident doctors to say, I think we'll go out on strike for another 5 days at a really busy time of the year when we've got a load of flu and doctors are normally quite busy signing patients off to get them back home for Christmas?
It's never right to strike, and it's never the first option. And I want to say that this is a phenomenon that's across the board, that young people are leaving the UK. The best minds, and you were talking about this, the best minds in the UK are leaving the UK. The most economically active people in this country are leaving the UK. The highest earning bracket, the people who would probably be contributing the most to tax, are leaving the UK. And the people who are left behind unfortunately the ones that can't leave the UK for whatever reason.
But so we're going to pay 250 grand to train up a doctor. They're going to get into massive debt. And then they're just going to leave because they don't want to accept the pay of the NHS. A lot of these doctors, we're constantly told by the BMA, they massively, this is about keeping the NHS alive, this particular monolithic structure for healthcare. And yet these people are quite happy to go off to Canada, to New Zealand, to Australia.
Nobody's quite happy to leave their family and travel miles away where they only
get to... No, but they're happy to go and work in a system that's quite different from the NHS, not a monolithic structure.
But nobody's happy to be doing that. We want to be working.
I know plenty of people who are happy to do it.
There's a lot of, changes that you have to undergo, etc. But it's at what cost? That's what we have to understand. The NHS is becoming more and more toxic to be working in.
What do you mean?
So we're talking about productivity. Of course it's down because no one is happy. Everybody I speak to is trying to look for a way out. That's consultants, resident doctors, Everybody, and that's also coming from the fact that the narrative that's being peddled in the media constantly of essentially scapegoating frontline staff essentially for the state of the NHS.
I don't think that is the case at all. I don't think there's any scapegoating of frontline staff. I think people give ridiculous amounts of support. There's the deification of nurses.
But the frontline staff are the ones that get the brunt of it. They face the brunt of it.
What is toxic? I mean, I've had to, go into hospitals, various things myself, or taken elderly family members. What is this toxic environment they're working in? Who's making it toxic?
Everything. The whole system is designed less to actually care for the staff that are delivering the care and more about numbers.
Diddums. I mean, good.
But it's not possible.
I tell you what, you
care.
try working in a newsroom in the 1990s where you're called the C word at 5:30 in the morning and you take it. I mean, I'm sorry, diddums. Isn't it the case that we've probably got quite a lot of people going into the NHS and pretty much every other career now who frankly just want to be mollycoddled. It's all a bit too much like hard work, and they have to do shift work, and they're having to deal with the ghastly masses, us ordinary people, and they just find it a little bit harder than they thought because they were the straight A student. I'm all for doctors being paid very good whack and having good working terms and doing well. But now they want to work, like GPs like yourself. I don't know what hours you work, but a lot of GPs, I want to work a 3-day week. I mean, sorry, no.
Because the work has become much harder. The population that we're dealing with have become much harder. They have much more complex healthcare problems. They're presenting later.
How much more interesting for you as a medical professional then?
Sorry, I missed that
How much
question.
more interesting to have, you've got cases. I mean, you wanted to be a doctor and now you're dealing with patients. And now you're complaining you've got patients.
Even as a GP, if I'm expected to do 40 minutes worth of work and squeeze it into a 10-minute appointment and keep delivering that on and on
Why
and on
are you expected to do 40 minutes worth of work in a 10-minute appointment?
That's because patients can't get to see GPs. There's not enough GPs. We have far less GPs compared to other countries in comparison to the number of patients
because you're working 3-day weeks. If you all worked a 5-day week, then there'd be more GP appointments, wouldn't there? And if people didn't have to wait weeks and weeks, then they wouldn't have a bigger problem.
Why are people working less and less? They're working less because they're not getting the hourly rate that they're supposed to. They're not getting the remuneration they're supposed to or they're expected to. They're not getting the support. They're getting a lot of the scapegoating.
That's not the case. One of the reasons why GPs, we're leaving aside from resident doctors, but often people end up in hospital because they can't see a GP and when they need to, is that actually GPs got that big whack pay rise some years ago. I remember my mum getting it as a GP, and for fewer hours, not working weekends, all of that, and then they were able to live on a 3-day working week, not a 5-day working week. That's great if you're a mum of young kids. That's wonderful. But unfortunately now, huge numbers of doctors now want to do part-time hours. It doesn't work for the NHS because we need doctors to be on call all the time.
Well, this is the problem. This is what's going to keep happening. For the doctors who can't leave the UK, they're going to go part-time. They're going to do other side hustle jobs, which a lot of GPs and other resident doctors are already doing in order to sustain themselves because they have to find a way out. And this is going to keep evolving in this direction.
I'm sorry, I'm going to have to get a tissue because I just need to cry for all these doctors. These doctors who having this terrible life. I'm sorry, Bhasha. This is embarrassing.
Whatever the reason might be, the truth is that
doctors are highly intelligent, highly trained, highly educated professionals. Isn't it about time you all started acting like it?
To keep them in the country. Otherwise, we're going to have to keep replacing them, paying extra money each time when we lose doctors and have to bring in doctors from other countries.
Let's come back to the issue. Doctors and the junior resident doctors, they're demanding a 26% pay rise. They've just had a 29% pay rise. Now,
what does that actually look like?
It was
backtracked. We have to actually talk about the numbers.
Bhasha, I know.
The percentage is less important. The actual hourly rate is more.
They have claimed, because they use this sort of spurious figure, they use RPI as a rate of inflation from 2008, that they are uniquely hard done by compared to everyone else working in the public or private sector since 2008. They're not. I want them to be well paid. They deserve to be well paid. It's a good idea to keep them well paid, to keep them in the system. However, they are not so much worse off than anyone else, given where we've been economically. Well, let's actually
talk about the numbers, because actually this is part of the narrative that is being peddled, the percentage. No one's talking about the fact that the percentage has been across 2 to 3 years, and no one's talking about the actual number. And I will say that, when people actually find out the actual number that is being asked of, which is to go from £18 an hour to £22 an hour for a doctor who's going to be saving your life, who's one of the,
I want doctors to be well paid. I pay my cleaner more than that. I'm serious.
Well,
I want doctors to be well paid. I'm a nice employer. What can I say? But this is my point. We want to be well paid. But can they read the room? Because we are in dire circumstances. I would much rather that money went to doctors than to...
read the room since he's come in? We've been going at this for over 2 years now in terms of the same repeated conversation. It's nothing new. There's been conversations that's been had when the strike's not been happening also. We can't talk about timing when this is just... There's equal responsibility for West Treating as well, and the government. I
think he thought he paid off the doctors in July 2024. Just finally, talk to me.
Kind of paid off. It was about full pay restoration. We were talking about also job security.
Well, no one else got full pay restoration in either the public or the private sector after what happened in 2008. No one else did. And what happened over lockdown?
Well, what about the job security? What about the job security?
I think doctors got more job security than most people listening to my show right now.
Well, that's not true for all the thousands of doctors who are actually out of work.
Well, that's what I want to... Finally, that's one thing I want to get to, because that is the thing I think concerns a lot of people. We're paying a lot of money to train doctors. They're getting into a lot of debt. We are then... only 10,000 training places for these resident doctors when there are 30,000 who are looking for work, highly qualified, skilled individuals. And then we're saying, well, we need to import all these people from abroad, often third world countries, who either need the doctors themselves or, by the way, are not as highly trained as our own doctors. And then we're not giving jobs to our own. That seems to me to be absolutely crazy. Why is that happening?
This is finally something that we agree upon, both of us. That this is
we agree doctors should be well paid as well.
There's the training post. Someone needs to be there to actually train the doctors. There needs to be resources and funding available to actually provide these training spaces. And unfortunately, I will say this, that these spaces, these jobs essentially are being redirected towards non-doctor staff because they're cheaper, essentially. And it's much cheaper to get the same, you just kind of train them up to do a few tasks without necessarily the depth of training, but just,
And then you don't have the other doctors who are more experienced to train. There's a ratio of staff I think they have to have. Bhasha, it's been fascinating talking to you. You go and have a little tearful session about how badly treated you and your mates are, but I hope you'll come back on the show again. It was really interesting to talk to you. Dr Bhasha Mukherjee, she's an NHS GP, very much on the side of the resident doctors. Love to hear your thoughts about that interview. Give us a call.